This program will help you learn about scuba diving. Although it can supplement training, it cannot take the place of a complete training program. Responsible participation in recreational scuba diving requires that you demonstrate the necessary knowledge and skills and be evaluated by a qualified NAUI instructor. Before beginning this program, take a moment and prepare to fully utilize the NAUI education system. You can do this by getting the textbook, a notepad, the NAUI pen and pencil set, the workbook, and dive tables ready to use. When you see the Take a Note icon, stop the program and jot down the information. It forms the basis for the final test. When you see the Open Book icon, stop the program and complete the corresponding questions or exercises in the NAUI workbook. Also, during the unit on dive tables, your progress will be easier if you follow along with the dive tables in hand. It is also easy to refer to the textbook as the same icons appear there and point to the related and highlighted text. In this way, you'll master the information faster, and you'll perform your best in the water sessions and on the final written exam. You'll be amazed at how easy it will be to earn your NAUI certification and qualify to begin a lifelong underwater adventure. NAUI Worldwide, the National Association of Underwater Instructors, presents Scuba Diver, a comprehensive video that describes the gear, skills, and basic concepts of scuba diving. Chapter 1, Introduction. What is scuba diving? SCUBA stands for Self-Contained Underwater Breathing Apparatus. You scuba dive with a compressed air cylinder that you wear on your back. The air is supplied to your mouth through a regulator that reduces the high pressure inside the tank to the same pressure as the water surrounding you. Your NAUI Scuba Diver certification course will teach you the fundamentals of diving. You will learn the principles of selecting and operating your equipment and the effects of diving on your body. Once you've completed the course and your open water certification dives, you'll be qualified to dive in conditions similar to those in which you did your open water certification dives. Your NAUI Scuba Diver certification is just the beginning of your adventures in diving. It's your license to learn more about the underwater world. As in any sport, there are risks involved with scuba diving. Most dives are very easy. However, on every dive, there is always a chance that you will need to exert yourself greatly. At times, diving can be strenuous. This is particularly true if you dive in cold water, in strong currents, or make beach entries through surf. As a diver, you need to recognize that risks exist, and you must be willing to accept this risk and take responsibility for your own actions. You will be asked to sign an express assumption of risk associated with diving and related activities, which explains the risks of diving. In the case of minors, parents will have to sign your waiver and medical history form. To engage in diving, you must have a sound heart and healthy lungs, have clear ears and sinuses, be free of any limiting disease or serious ailment, and be free of any condition that can cause unconsciousness. Also, women that are pregnant should not dive. You will be asked to complete a medical history form before you can participate in the water sessions. If you indicate any problems that might affect your ability to dive, you'll be asked to have a medical exam and obtain written medical approval. You also must be fit to dive. Initially, this means that you must have good aquatic ability. You must be able to swim at least 200 meters or 220 yards nonstop without fins or other aids. Good health and fitness are important for diving safety, but use of drugs can lead to problems underwater. Substances such as alcohol, marijuana, and cocaine should never be used before diving. Avoid taking any over-the-counter or prescription drugs that recommend not operating machinery. If you are ill and do not feel well enough to dive without taking a drug, you should not dive, even if you feel fine with medication. The effects of drugs can be changed by pressure in unpredictable ways. Medication can mask the symptoms of your illness, but that illness still exists.